Hello students, welcome to MKJ Pharma classes. Today we are going to discuss about uses of tetracyclines. Students, before we start the lecture, I request you to kindly like and share this video, and also don't forget to subscribe to our channel, that is MKJ Pharma classes channel. Students, the uses of tetracyclines can be categorized into following broad categories. Okay, that is empirical therapy as a first choice of drug, as second choice of drugs, and other conditions. So today we are going to discuss about all these uses in detail. So first use is as an empirical therapy. Tetracyclines, as you know, it is a broad spectrum antibiotic. As a result, it is used in various conditions where the nature of the organism or the sensitivity of the organism is not known. So in all such cases, tetracycline is a very good drug for empirical therapy. The second class is as a first choice drugs. Now these are the conditions where tetracycline is used as the drug of choice. So what are these conditions? Venereal disease, that is sexually transmitted disease, then atypical pneumonia, cholera, brucellosis, plague, relapsing fever, and rickettsial infections. So here we have a mnemonic to remember all these conditions where tetracycline is used as the first line of drug. So we can remember it as RBCs are very precious. RBCs are very precious. So here RBC, the R stands for relapsing fever and rickettsial infection. B stands for brucellosis. C stands for cholera. A stands for atypical pneumonia. V stands for venereal disease, and P stands for plague. So it's very easy to remember if you remember this mnemonic. RBCs are very precious. Relapsing fever, rickettsial infection, brucellosis, cholera, atypical pneumonia, venereal disease, and plague. So let us see all these conditions in detail. So the first condition is venereal diseases. Venereal diseases are your sexually transmitted disease, that is the STDs. So tetracyclines, they are used in various STDs like chlamydial non-specific urethritis or endocervicitis. Now in this case, we use doxycycline for 7 days. Now this doxycycline for 7 days is as effective as azithromycin in a single dose. Then other conditions are lymphogranuloma venerum and granuloma inguinal due to Kellim granulomatis. Now if you remember, these are the conditions of genital ulcers. Okay, so in this case, in granuloma inguinal, tetracyclines, they are administered for 3 weeks. The second use is in case of atypical pneumonia. Now atypical pneumonia due to Mycoplasma pneumoniae is treated again with your tetracycline. So psittacosis is treated with 2 weeks by tetracycline. Now what is psittacosis? Psittacosis is a contagious disease transferred from the birds to humans. So in psittacosis we use tetracycline for 2 weeks. Next condition is cholera. In case of cholera, tetracycline is used as an adjuvant therapy, as an add-on therapy. Now the mechanism how it acts here is, in case of cholera, it reduces the volume of the stool and also the duration of diarrhea. Then the next condition is brucellosis. Brucellosis is a condition where the infections, the bacteria, they are transferred through animals, maybe through the milk of cows and buffaloes and so on. So in case of brucellosis, again we are going to use doxycycline in the dose of 200 milligram per day and in combination with rifampicin 600 milligram per day, and this we are going to use for 6 weeks. Now in case of acute cases, gentamicins, they also can be combined with your doxycycline. So brucellosis, we use doxycycline plus rifampicin, and in acute cases gentamicin with doxycycline. Next, it is used in plague. So in both kind of plague, that is bubonic plague and pneumonic plague, tetracycline is the drug of choice. Then relapsing fever, which may occur due to Borrelia recurrentis. And lastly, it is used in case of rickettsial infections, which is manifested in the form of typhus or Rocky Mountain spotted fever, Q fever, etc. Now it is important to know that chloramphenicol is an alternative. Chloramphenicol is another broad spectrum antibiotic. So chloramphenicol can be used as an alternative to tetracycline in case of rickettsial infections. Next we have conditions where tetracyclines, they are used as second choice of drugs. So these are tetanus, anthrax, actinomycosis and diphtheria infections, gonorrhea, syphilis in patients who are allergic to penicillin, leptospirosis, pneumonia due to chlamydia pneumoniae, chancroid and tularemia. So let us see the mnemonic, how to remember all these conditions. So mnemonic is Atalji took CT scan at central government lab. Atalji took CT scan at central government lab. So here Atal stands for anthrax, tetanus, actinomycosis and listeria. Then CT, that is chlamydia pneumoniae and tularemia. Scan stands for syphilis. Central stands for chancroid, government stands for gonorrhea and lab for leptospirosis. So uses of tetracycline as second choice of drug can be remembered with mnemonic Atalji took CT scan at central government lab. Right? Now in this table it summarizes the various disease where tetracycline is used as second choice and the drug which acts as a first choice in such conditions. So your Atal, that is anthrax, tetanus, actinomycosis and listeria, in all this case penicillin or ampicillin, these are the first choice of drug and second choice will be definitely your tetracycline. Then leptospirosis, again the first choice is penicillin. Now we have to remember in leptospirosis your doxycycline is used in the dose of 100 mg BD, that is twice a day for total 7 days. Now in case of use as an prophylactic during epidemic, the dose is 200 mg weekly. So 100 mg BD for 7 days, or in case of prophylactic the dose is 200 mg weekly. Then in case of pneumonia due to chlamydia pneumoniae, we already know that in case of pneumonia we use azithromycin and the tetracycline can be used orally as well as topical in this case. Then tularemia, the drug of choice is streptomycin. Syphilis, in patients who are allergic to penicillin, we go for third generation cephalosporin, that is ceftriaxone. Ceftriaxone. Then chancroid, we use ceftriaxone or azithromycin. And in case of gonorrhea, we use either ceftriaxone, amoxicillin or azithromycin. Now let us see the other situations where tetracyclines can be used. So they are used in urinary tract infections, community acquired pneumonia, amoebiasis, chloroquine resistant Plasmodium falciparum malaria, where it is used as an adjuvant to your quinine or artesunate. And acne vulgaris and COPD, that is chronic obstructive pulmonary disease. Again here it is used as a prophylactic. So how to remember the other uses can be remembered by the mnemonic which I have made is visit Andaman Union Territories with CAP and CAM. I repeat, visit Andaman Union Territories with CAP and CAM. If you are going to visit Andaman, then definitely you have to use cap or hat, right? And camera is required to take beautiful photographs. So we can remember the other uses of tetracyclines by using this mnemonic. So here A stands for acne vulgaris, UT stands for UTI, that is urinary tract infections. CAP stands for community acquired pneumonia, right? CAP stands for community acquired pneumonia, and CAM stands for COPD, amoebiasis and malaria. So the uses of tetracyclines, they can be summarized through this flow chart. So we have seen that the 4 categories where tetracyclines are used are as an empirical therapy, as a first choice drug, as a second choice of drug and other conditions. To remember first choice of drugs, we made a mnemonic. RBCs are very precious. So R for relapsing fever, rickettsial infection, B for brucellosis, C for cholera, very venereal, precious, plague, right? Then the second choice of drugs, we made the mnemonic, that was Atalji. Atalji went for CT scan to central government lab, right? So Atalji is anthrax, tetanus, actinomycosis and listeria, right? Atalji went to for CT scan. CT stands for chlamydia pneumoniae and your tularemia. Scan as stands for your syphilis, and central government. Central is chancroid, government gonorrhea, and lab for leptospirosis. And other uses. So this we have remembered by using mnemonic. To visit Andaman and Union Territories, we need CAP and CAN. Okay. So Andaman for amoebiasis, Union Territories will come from UTI, and you need CAP, community acquired pneumonia, and CAM. CAM is COPD, acne vulgaris, and M for malaria, that is chloroquine resistant falciparum malaria. So students, if you like today's class, then kindly like and share the video, and also do not forget to subscribe to our channel to get regular notifications.